everyone, I am estimating Lara, your nurse for today. So we are going to do a return demonstration about essential intrapartum and newborn care, together with my partner.
I am positioning Lopez, and now let's do the return demonstration.
Open gloving is a technique used in essential intrapartum care to maintain a sterile field and reduce the risk of infection when performing procedures that require sterile hands, like assisting in delivery. This helps to prevent the transmission of pathogens to the mother and baby, ensuring a safer birthing environment. Immediate drying. Using clean cloth, thoroughly dry the baby, wiping the face, eyes, head, front and back, arms and legs. This helps prevent heat loss in newborns, who are highly susceptible to hypothermia. Newborns lose body heat quickly through evaporation, especially when wet from amniotic fluid. But drying the baby immediately after birth will reduce heat loss, stabilize body temperature, and support optimal oxygenation, which is essential for healthy adaptation to life outside the womb. Skin-to-skin contact. Skin-to-skin contact immediately after birth is vital because it promotes bonding, stabilizes the newborn's temperature, heart rate, and breathing, and also supports breastfeeding initiation. This close contact also reduces stress for both mother and baby, boosts the baby's immune response, and contributes to health, physical, and emotional development. If a baby is crying and breathing normally, avoid any manipulation such as routine suctioning that may cause trauma or introduce infection. Place the newborn prone on the mother's abdomen or chest skin to skin. Cover the newborn's back with a blanket and head with a bonnet. Place identification band on ankle. Proper cord clamping and cutting. Clamp and cut the cord after cord pulsation have stopped, typically at 1 to 3 minutes. Put clamps tightly around the cord at 2 cm and 5 cm from the newborn's abdomen. Cut between clamp with sterile instrument. Delayed cord clamping, typically done at 1 to 3 minutes after birth, allows extra blood from the placenta to flow to the newborn, providing additional iron storing to support healthy development and reduce the risk of anemia. It also promotes better circulation and improves oxygen delivery. Timely cord clamping is important for stabilizing the newborn's blood volume and supporting a smooth transition to life outside the womb. Observe for oozing blood. We observe for oozing of blood at the cord clamp site to ensure proper hemostasis and prevent excessive blood loss in the newborn. Blood oozing could indicate an inadequate clamp, potential bleeding disorders, or issue with clotting. By monitoring for any oozing, we can promptly address and manage bleeding, reducing the risk of complications such as anemia or infection. Do not milk the cord towards the newborn. We avoid milking the umbilical cord toward the newborn because it can rapidly increase blood volume, potentially leading to complications such as excess red blood cells and jaundice. Rapid transfusion of blood can put stress on the newborn's cardiovascular system. Instead, delayed cord clamping allows a more gradual transfer of blood, giving the baby time to adapt and reducing the risk of these complications. After cord clamping, ensure oxytocin 10 intramuscular is given to the mother. Oxytocin is administered to the mother after birth to help prevent postpartum hemorrhage, a leading cause of maternal mortality. It stimulates uterine contraction, which aids in the delivery of the placenta and compressed blood vessels in the uterus, reducing blood loss. By promoting effective contractions, oxytocin helps maintain uterine tone and support a safer recovery for the mother. Non-separation of baby from mother and breastfeeding initiation. Observe the newborn only when the newborn shows feeding cues, such as opening of mouth, tonguing, licking, growling. Make verbal suggestions to the mother to encourage her newborn to move toward the breast, such as nudging. Immediate and continuous contact strengthens the bond between mother and baby, reduces stress for both, and stabilizes the newborn's vital signs, like temperature and heart rate. Early breastfeeding helps establish milk production, provides the baby with colostrum, which is rich in nutrients and antibodies, and promotes proper latch and feeding patterns. This close contact also supports the baby's immune development and enhances maternal instincts and confidence in caregiving, which is essential for both physical and emotional well-being. Counsel on positioning and attachment. When the baby is ready, advise the mother to make sure the newborn's neck is neither flexed nor twisted. Make sure the newborn is facing the breast with the newborn's nose opposite her nipple and chin, touching the breast. Hold the newborn's body close to the mother's body. Support the newborn's whole body, not just the neck and shoulders. Wait until her newborn's mouth is open wide. Move her abdomen or newborn onto her breast, aiming the infant's lower lip well below the nipple. Look for signs of good attachment and suckling, such as mouth wide open, lower lip outward, baby's chin touching breast. Suckling is low lip with some pauses. If the attachment of suckling is not good, try again and resist. Preventing ophthalmia neonatally, an eye infection in newborns often caused by exposure to bacteria. During delivery, it is essential to protect the baby's eyesight. This infection can lead to severe complications, including blindness if untreated. To prevent it, newborns are commonly given prophylactic eye treatment such as antibiotic ointments shortly after birth. This precaution reduces the risk of infection, safeguarding the infant's eye health and overall well-being. Administer erythromycin or tetralysin ointment or 2.5% povidone iodine drops to both eyes after the newborn has located the breast. Do not wash away the eye antimicrobial. Give vitamin K prophylaxis. Inject a single dose of vitamin K 1 mg IM. If parents decline intramuscular injection, offer an oral vitamin K as a second line. Inject hepatitis B and BCG vaccinations. Vitamin K, hepatitis B vaccine, and BCG are essential in newborn care. Vitamin K prevents bleeding disorders by aiding blood clotting. Hepatitis B vaccine protects against liver disease and infections. BCG vaccine guards against tuberculosis, particularly severe forms in newborns. Anthropometric measurements. Weigh the newborn and record by clean tape measure. Measure the head, circumference, chest circumference, abdominal circumference, and birth length. Anthropometric measurements are important for assessing a newborn's growth, identifying potential health issues like low birth weight, and monitoring developmental progress. They help ensure timely intervention if needed. Washing hands is crucial to prevent the spread of infections, ensuring a safe environment for both caregivers and patients, especially in newborn and maternal care. Proper hand hygiene reduces the risk of cross-contamination and healthcare-associated infections. Fold diaper below stump. Keep card stump loosely covered with clean clothes. If the stump is soiled, wash it with clean water and soap. Dry it thoroughly with clean cloth. Explain to the mother that she should take care if the umbilicus is red or draining pus. Teach the mother to treat local umbilical 3 times a day.